what's Botox best for? Where in the face?
Yes, so Botox is a neurotoxin. Oh, I went blank. And there's also Dysport. There's other ones, Xeomin, Jeuveau. So what these do is they paralyze the muscle for about 3 to 6 months. So this is something that you would be getting injected with twice a year. Originally, we started just around the eyes.
Right.
Forehead, between the brows, but now we could go into the nose to help the movement from the nose dropping, go into the lips from helping from the smoker lines.
What age group would you say, hey, let's start Botox, let's do this?
I think it depends patient to patient, but I would say in the early 20s.
Yeah, I agree.
But there are a lot of patients nowadays, there's so much sun exposure and looking at our, phones, the computer, so they're aging a lot more. And also like with, the necks, like you see
bands.
More of, the bands and the double chins because people are looking at their phones like this, and a lot more people are out in the sun, not wearing sunglasses, so they're squinting. So paralyzing, I would say.
About 20s.
Yeah, I would say start at 20.
I agree with that. And let me just say that people are afraid of Botox. There are literally 0 to no side effects. I mean, once again, if the injector is a little bit careless and puts too much, they can paralyze to the point where the brow can droop. Botox, just to reiterate, it is freezing your muscles of lines of action. I'm a good candidate. I'm a bad boy. I don't do Botox, but I'll show you real quick. Smile lines, frown lines, and raising brows. Those lines are muscle motion lines, and we want to prevent those. Because let's say for me, if I've already got lines and I'm going to do Botox too late, I can never irreversibly erase those lines.
Right.
But that's why when you start in your 20s, it's very important because you're doing it for maintenance. The analogy is like in your car, you're doing your oil changes to keep your engine fresh for the life of that engine.
Right. And why I suggest, a lot of you are thinking, wow, that young? Why would you start injecting that young?
It's prevention.
But just like you said, it's preventing it. So when you start seeing some movement, yes, we all move, right? But when you start to see the lines kind of settle in at the end of the day, that's how you know it's time. And if you started at a perfect time and you're staying on top of it twice a year, you're not going to age.
And
that muscle isn't.
Then you're going to avoid me doing your forehead lift at age 50 versus age maybe 60, 65. So again, I just think it's such an important maintenance part of, keeping the aesthetics fresh and rejuvenating.
Right.
How about fillers? When would you say you started age of fillers on patients?
Fillers are, I would say, there's this whole trend that was going on with Kylie Jenner. And so there were patients that, there were even patients where their moms were coming in and asking like, oh, if I sign this paperwork, can they have their lips done? But no, we've never done that. So I would say you can start at 18 years old. But the typical age of when somebody actually starts fillers, and when we're talking about dermal fillers, we're talking about filling up the area. So as we age, we start to get a little hollow here. So we're just giving that natural plump.
Yeah.
When we go into the lips, if it's an aging lip, we're just helping like give that life back to the lip. But there are patients that they want these big lips that, I don't see it as much anymore.
Yeah.
But there are patients that do, and there's nothing wrong with that. That's their personal preference. But so derma fillers, like you've heard of Juvederm. There's a whole line of them. So that's to give you volume.
Right. What are the 3 areas that you think are important to fill? If I were a new patient,
Right. It depends on the age, right? So let's say somebody that's in between 35 and 50, where, everything starts to fall because there's this gravity. We hate gravity.
Gravity and deflation.
Yes. So you start to get a little bit droopy here. So if we put some filler into the cheeks, if you're ever in the mirror and you're like, oh, do I need a facelift? So we would go into the cheekbone, the jawline. I think everybody like to make it look, I think to make my patient look perfect, I like to go into the cheek, in the jawline, the chin, and a little bit in the lips, in the mid part of the lip.
Yeah. And I think, going over a little bit about aging and how we age, you hit the nail on the head. when we talk about gravity, there's also, I use the analogy, you hear me all the time, a grape turning into a raisin.
Right.
We're all going to be raisins at 90. Sorry, guys.
No.
So when we shrivel, I don't want to use that word, but when we deflate, gravity plays a role. And I think the first area that you talked about is the cheeks. So when we're looking at the cheeks here and we see the element of volume going into what we call the nasolabial fold, what we really want to volumize is the cheeks. That is the primary, I would say, filling region versus like, didn't we inject in the nasolabial a little bit too much?
I think that was like in the beginning when we all started injecting years ago. It was like, okay, so to get rid of, because we weren't really going into the cheek, it was like to get rid of those nasal folds, we're going to go into directly right into that fold, put some in the lips, but then it starts to give a little bit of like a monkey.
Yeah, like a mouthy monkey. And yeah, I agree. In the early ages, about 10, 15 years ago, we were injecting these areas. We really need to look at the primary focus of aging, which is volume in the cheeks, dropping into the nasolabial folds. So once again, go to a nurse injector that is very, very experienced and is listening to what your goals are. I think your comment about the lips is a good one. I think we don't like to do anything too extreme if you're trying to do these Kylie Jenners and stuff.
Yeah, and it's like you don't want to look full. You want to look youthful.
And natural.
Yeah.
I think both you and I kind of pride ourselves in being natural with our results. Once you're done or you're doing too many fillers and you're like, wow, I really need to do a lift, and I come on board, I think the most common comment when they're seeing before and afters and looking through my book, they're saying, wow, these look very natural. They don't look pulled. We're not doing like Kenny Rogers, like, woo, it's not.
So what if a patient comes into you and they've been having injectables, derma fillers to, lift their face and they come into you and their face, you can tell that they've had a lot of derma filler, but they're like, oh, you know what, Dr. Park,
I'm sending it back to you.
No, I really want a facelift. Like, it's just not getting, do they have to wait a certain amount of time or?
That's a good point. You've probably seen an overdone face, and you and I have both seen that. There are times where I think you need to dissolve that's the good thing about fillers. It is reversible. If we're talking about two options of volumization, you've got fillers, safe, dissolvable. Then people talk about fat grafting. The issue about fat grafting is it's somewhat unpredictable and it's permanent. Once you make a mistake, it's very difficult to, reverse. But
that just goes back to trends, right? Yeah. Because I'm hearing a lot of patients now, they're like, oh yeah, I did a fat transfer to my face. And I'm like, oh no, because it could shift. Yeah. It could, it dissolves. It could look lumpy. It could,
Right. And I do a lot of revisional surgeries for fat grafting. Here's an example. Some people will fat graft in that tear trough right here in the lower lid. And I've seen it where it's been a little too lumpy and I have to surgically remove it. It's very, very, very challenging. So once again, you want to go to a very experienced, either board certified plastic surgeon or a certified nurse that's injecting. Got to be careful with injecting and volumization, I think.
Yeah. So I want to know, when you go in though, when you say, because I actually have never been in that surgery, when you see there's fat pockets.
Right.
So you just remove it?
Yeah, so that's a good question. Now you're talking about the lower lid is a very complex area, and when you look at someone, they might have a little bit of fullness, we call them bags, or they can have a little hollowness. And what's interesting about the lower lids is that you can actually have different options. You can fill the valley, if you will, to make it smooth, or you can take away the bag, which is the hill, the fat pocket, and that's more of what I do surgically in order to have more of a permanent result. So one thing about fillers is we know they're not permanent. They last about 1 or 2 years. Right. But once a person has noticeable large bags in the lower lids, that's when I'll come in and do a lower lid surgery to remove the fat. And we get amazing results. I love eyes. Eyes is like one of my favorite. It's a very quick, less than an hour surgery. and people just look so refreshed. You know, we communicate with our eyes.
It's the pathway to the soul.
It's the window to your soul.
Oh, the window.
Yeah, or something like that.
Well, that's very great. Thank you for giving us that information.
Yeah.
Well, y'all, thank you so much. We're getting to the end here. Thank you for tuning in and listening to us on Go Country 105.
If you want to do a consultation with me and or my beautiful injection nurse, it's 1-888-900-9065, 1-888-900-9065. Our website is faceletterndbody.com, and follow us on IG at Face and Body Plastic Surgery.
If you want to listen to us, tune in every Sunday morning at 7:30 on Go Country 105 with Beauty and the Blade, where beauty begins.